Hi, my name is Heather Grant. This is my Maryville head-to-toe assessment. I'm going to go ahead and get started. First, I'm going to have the patient empty their bladder and change into a gown, measure their vital signs, height, weight. I did distance vision with the Snellen chart. They tested 20/20 in both eyes. No need for corrective lenses. Also did the near vision chart, or the distance vision chart. I'm going to move on to head and face. I'm looking at the skin. Her skin tone is even throughout. I don't see any abnormal freckles or moles on the face. Everything looks symmetrical. The eyes are symmetrical, and the skull, I don't see any visible masses. No alopecia. The eyelashes are distributed evenly on both sides, as well as eyebrows. No extra facial hair noted. No visible masses or nodules on the face. I'm going to go ahead and palpate the scalp. I don't feel any nodules or masses of any sorts. The hair is distributed evenly through the skull. I'm going to palpate the facial bones. Everything feels normal throughout. Can you open and close your jaw? The temporal mandible joint, I don't feel any popping or clicking. Do you feel any popping when you open and close? No. Okay. I'm going to palpate the sinuses. Do you feel any fullness, pressure, pain?
No.
Okay. Next, I'm going to move on to the eyes. Externally, I don't see any redness, crusting, drainage from the eyes. Let's see, I'm going to palpate next. No nodules. The lacrimal apparatus, I don't feel any nodules. There's no tearing there. The sclera and conjunctiva are both sclera clear. Conjunctiva, I don't see any pinkness on both sides. Let's see, I'm going to move on to the pupillary response next. All right. Pupils are about a 4 on both sides. Pupils are equal and reactive to light. I would do the swinging flashlight test too, but I don't have a flashlight handy. The pupillary response is normal on both sides. I'm going to have the patient follow my finger next. I'm going to do the 6 cardinal fields of gaze. No nystagmus noted. The extraocular movement is intact on both eyes. Let's see. Next I'm going to do the cover-uncover test. I'm going to look for any lateral movement of the eye. None noted on both sides. I'm going to inspect red reflex next. Go ahead and look at me. Red reflex present in both eyes. Next I'm going to move on to ears. Need to get my otoscope ready here. First I'm going to inspect alignment of both ears. Both are aligned well and placement is good. I'm going to palpate the auricles. on both sides, which are normal. I'm going to go ahead and look in both ears. Tympanic membrane is pearly gray. I'm able to note the bony prominences in the ears on both sides. The same with the right ear. No abnormalities or drainage noted on both sides. Next, I'm going to do a hearing test. I'm going to put this on top of your head. Let me know if you hear it evenly on both sides. No lateralization noted. Tell me you don't hear it anymore.
No.
Okay.
I don't hear it.
Okay. Hearing's not very great on the right side. Left side seems pretty normal. Tell me you don't hear it anymore.
No. No.
Okay. The patient passed the hearing test on that side, on both sides that time. I'm going to inspect the nose next. Looking outwardly, I don't see any drainage, any redness or crusting. The septum doesn't look deviated. Nose placement is good. I'm going to determine patency of each nostril. Go ahead and suck in. Suck in. Were you able to breathe in and out okay?
Mm-hmm.
Okay. Next, I'm going to inspect the turbinates are normal. No redness. I'm able to view both sides. Good on both sides. Next, I'm going to inspect the lips. They're symmetrical, pink. They look moist. No dryness or extra wrinkling noted, which would be indicative of dehydration. Go ahead and open your mouth. Alright. Tongue, stick your tongue out. Alright. Exhale. Okay, tonsil pillars on both sides are noted. No tonsillar swelling or exudate noted. No white patches in the mouth. Can you lift up your tongue? It's important to inspect underneath the tongue for like any type of cancer. No white patches or nodules, anything abnormal noted. Patient does have all of her teeth intact. A few dental caries here and there noted, and tongue was symmetrical on both sides. Let's see. The oral pharynx. I didn't see any redness, swelling, or exudate. No halitosis noted. The movement of the tongue was normal, and I don't think I'm going to test gag reflex on the patient to make her uncomfortable, but I would want to test that as well. So next, I'm moving on to neck. It does look symmetrical on both sides. I don't see any pulsations noted. Trachea is midline. I'm going to go ahead and assess carotids on both sides. They're both 2+ and normal. I would assess for JVD as well, which was normal on the patient. The patient doesn't have a JVD. go ahead and push up on my shoulder shrug is even on both sides. Tracheal position, like I said, was normal. And I'm going to have you swallow. Thyroid normal. I'm going to go ahead and palpate for lymph nodes as well for any swelling, occipital, pre and post auricular, tonsillar, submental, submandibular. Don't feel any. Can you shrug your shoulders forward and back? No nodules or swelling noted there. Next, I'm going to auscultate the carotid arteries, and I'll be right back for that. Alright, can you turn your head that way? Okay, middle. No bruit noted on both sides. I'm going to also auscultate the thyroid. No pulsations noted. I'm going to go on to the upper extremities. I'm inspecting the skin. I don't see any obvious masses, nodules, or any skin abnormalities, abnormal moles or freckles. Muscles, like even on both sides, and patient does have muscle mass on both sides. I'm going to go ahead and palpate. I'm going to go ahead and look at your fingernails. Cap refills normal. Nails are normal. There's no whiteness or ridges on both nails. No clubbing or anything noted. Assess radial pulses on both sides. Both are 2+. Brachials as well. Let's see, I'm going to inspect the skin on the back and posterior chest. The skin was normal on both sides, and the thoracic configuration was normal. I did palpate and percuss the costovertebral angle, which is normal. I'm going to inspect the respiration. Respirations are normal. I would say about, the patient's breathing about 20 to 22 a minute. Chest rise and fall symmetrical on both sides. Next, I'm going to palpate for pharmacist. Say 99.
99.
Say it again.
99.
It's felt on both sides. I'm going to go ahead and percuss. And can you lift up your arm, please? Lungs are resonant on both sides. Go ahead and breathe in and out. And I'm going to have to put my hands down here. Breathe in and out. Diaphragmatic excursion is normal. Next I'm going to auscultate. Okay, deep breath. Oops, sorry about that. Okay, tracheal breath sounds were normal, along with bronchovesicular and vesicular breath sounds throughout. I didn't hear any adventitious sounds at all. And you say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, no muffled sounds throughout. And can you whisper 99? Alright, that exam was normal. Next I'm going to move on to cardiac. Gonna get my bell ready here. Aortic, no murmur noted. No murmur noted pulmonic. Herbs, no. No murmur noted tricuspid. Heart sounds, the PMI or mitral, no murmur. Rate and rhythm within normal limits. No heaves or lifts noted, or abnormal pulsations. I'd have the patient, like I said, recline at 45 degrees and look for JVD, which she does not have. Gonna have you go ahead and lay down next. Right now I'm just inspecting the abdomen. I already lifted the patient's shirt up. I didn't see any abnormal coloration or bruising. No visible pulsations noted. Movements even on both sides, contours even. I would listen roughly about 5 minutes for all 4 quadrants altogether. Bowel sounds are active, Next, I'm going to go ahead and percuss for tone, liver borders, and splenic dullness. The liver is dull. I estimate it to be about 3 to 5 centimeters. Spleen, dull, and I'm gonna palpate or percuss the quadrants here. Patient does have some tympanic areas noted. Let's see, I'm going to do light palpation and deep palpation. Go ahead and breathe in. Yeah. And out. Alright. Not able to palpate the spleen or the liver. Tell me if you have any pain. Palpating for any masses, light palpation. None felt, patient doesn't have any pain elicited. Gonna do deep palpation next. No pain elicited. No masses or abnormal nodules felt with that as well. I'm gonna also, I forgot to listen for aortic pulsation. No bruit noted. And can you like bend up a little bit like you're doing a squat? Okay. Muscles are activated throughout the abdomen. No problems with that. You can go ahead and lay down. Next, I'm going to move on to the feet and legs. Skin colors, even on both sides. I don't see any shininess or redness noted on both legs. No clubbing of the toenails. No nodules or skin discolorations of any sorts noted bilateral. No edema noted. Gonna palpate. She doesn't have any hair on the legs because they're shaved, so I can't look at hair distribution. Muscle mass looks even on both sides. Next, I'm gonna palpate for temperature, which is warm to touch. Muscles feel even on both sides. Cap refill is normal. The dorsalis pedis pulse is 2+ on both sides. Posterior tibial pulse is normal on both sides. Popliteal is normal. Can you push down on my hands? Pull up. Any pain in your calves?
No.
Muscle strength. Push up on my hand. Push up. Muscle strength is even on both sides. Next, I'm going to move on to my neuro exam. I'm going to have you sit up, if that's okay. I'm going to have you close your eyes. And I'm going to wave something in the patient's face here to see if they can smell it. Tell me what you smell.
Peanut butter.
Yes, you got that right. And one more thing. Testing the olfactory nerve here. Tell me what you smell there.
Chocolate.
Great. Okay. So that was for smell. I would also test for taste, but we're not going to do that. Already tested optic nerve 2 with the Snellen chart, Rosenbaum and confrontation. Trigeminal nerve, we can do corneal reflex and light sensation on the head. I'm just going to take a cotton swab here. Corneal reflex is intact. Can you close your eyes for me? Tell me if this is like a soft touch or hard touch.
Hard.
Does it feel even?
Yeah.
Do you feel that evenly on both sides?
Mm-hmm.
Okay. Let's see. I'd have the patient open and close the jaw against resistance, which they did already, and that was normal. I already tested cranial nerve 8 with the Weber-Marini test. Glossopharyngeal and vagus. I assessed gag reflex already and had the patient say ah. So we did that. In the spinal accessory, I had the patient do a shoulder shrug. And hypoglossal, we tested the tongue movement already as well, which was normal. I'm going to move on to sensation. I'll have you close your eyes. Tell me if you can. Tell me when you feel it on both sides.
No. No.
Okay. If the patient was diabetic and we suspected neuropathy, I'd do the monofilament. If you feel this evenly here.
Mm-hmm.
And check the toes. No neuropathy noted. Bilateral patient felt that evenly. I want to test something and tell me if you feel 2 points or 1 point when I'm touching you.
Just one. Two. One. Two.
All right. Patient 2 point discrimination was normal on both sides. Also temperature, sensation, normal as well. The patient's able to discriminate hot and cold. Can you clench your teeth? Patient's able to clench teeth open. Stick your tongue out. It's symmetrical on both sides. Wrinkle your forehead. Smile. Puff out cheeks. Alright, that is normal on both sides. Let's see, I'm going to test muscle strength. Push up. Put your arms out. And in on my hands. Great. Squeeze my fingers. Alright, great. Let's see, push up on my hands. Pull back. Push with your head. Push with your head. Move back. Back. Alright. The muscle strength is good on both sides. The spine, palpating. No abnormalities there. There is no curvature, scoliosis, lordosis, kyphosis. of the spine. No pectus excavatum or carinatum. I'm going to go ahead and test the reflexes here. Alright, takes a minute to get them. Alright, they're both normal on both sides there. Alright. Sorry. Knee reflex on the right's normal and normal on the left. We'll do the Achilles. They're normal on both sides. And that concludes our exam now. Thank you.